So Dr. Haviland began her Navy career as an active duty psychologist, completing her internship at the National Naval Medical Center in Bethesda, Maryland. She worked at the Amundsen Scott stationed in the South Pole, where she conducted individual and community assessments for, quote, winter over staff, and collected data on seasonal affective disorder and the effects of sustained isolation for the University of San Diego and NASA, respectively. She spent 6 years consulting with corporate executives in the United States and Germany in the areas of change management, merger and acquisition integration, high potential development, succession planning, and faltering executive interventions. Dr. Haviland was part of the advocacy team that wrote the bill that became the law, allowing psychologists with appropriate education to prescribe medication in the state of Idaho. As past president of the Idaho Psychological Association and consultant at Idaho State University, she acts as a liaison between the Idaho Psychological Association and the MSCP and ISU's Department of Pharmacy. She was in the first cohort set to complete the MSc program, and she did. So you completed your MSCP in August 21, and you will talk to us about your prescribing work in Idaho. Thank you, Dr. Haviland.
I am happily employed at the one of the two regional medical centers in Boise and Nampa, Idaho. So I work at two different clinics on a comprehensive pain and spine team with physicians, nurse practitioners, PAs, and two psychologists. And because I wasn't that busy when I started 2.5 years ago, they opened me up for kind of referrals from family medicine and primary care physicians all the way around. So I have found myself in a very diverse practice with, I got two clozapine patients right now. I prescribed my first. By the way, what Beth didn't say is I'm a provisional prescriber, so Idaho requires 2 years of supervision post-PEP, and I graduate in October of this year, but right now I have a wonderful supervisor who's a dual-boarded psychiatrist who specializes in geriatric psychiatry. So I am doing the geriatric route so that I can see folks over 65. Idaho has a requirement that you have to specialize one of your 2 years in provisional prescribing in either pediatrics or geriatrics if you want to treat those populations. So I'm going with the older folks who I absolutely adore. I love working at the hospital because we don't turn anyone away, and I love working in an interdisciplinary treatment team. The challenges have been that Epic, which is our EMR, that did not recognize me as a prescriber, and so I've had all sorts of computer documenting and scheduling and all sorts of issues, as well as, and I'm not sure you know this, Beth, but my hospital, when I went to start to bill for prescribing, kind of wigged out, ran it up all the way up to the general counsel, and I am not allowed to bill for prescribing, only therapy. Because of the Medicare versus Medicaid private insurance disparity, they feel like it's an ethical dilemma and they don't want me to charge some people for the same thing I'm not charging for others. And I get it. So my numbers, my billing numbers don't look as good, but my patients get treated all the same. Most of my patients are therapy and medication, which I take a lot of pride in. I only have one medication only patient, and that patient is seen for counseling by the other psychologist on my team. So I'm excited. I'm excited for Beth's um, election to president of APA. I'm excited for what's moving forward, and I am grateful for the shoulders I stand on. Thanks.
Wonderful. Thank you so much. So great to see you and hear you. Thank you so much.